Good afternoon to one and all present here. We welcome you for the National Faculty Development Program on Wellbeing and Salatogenesis of University Students, organized by Students Salatogenesis Committee, Department of Psychiatry, MGMCRI, Pondicherry, for the 5th session. We would like to welcome our Dean Sir, Vice Principal Madam, and all the organizing team of this FDP. Today's session will be on mental health problems and substance use disorder among university students. This session will be moderated by Dr. Surya Kumar, Assistant Professor, Department of Psychiatry, MGMCRI, Pondicherry. Sir has studied MBBS from Madurai Medical College and MD Psychiatry from MGMCRI. He actively participates in OPIP case services, outreach and community services in psychiatry. Sir is also a member of palliative care team and pharmacovigilance committee of SBV. Sir has published research papers across various national and international reputed scientific journals, attended several CMEs and workshops at state and national levels, and presented papers in various national and international conferences. Sir's area of interest is mainly addiction psychiatry, consultation license psychiatry, geriatric psychiatry, and community psychiatry. Sir will be the moderator of today's session. May we please request Sir to come and introduce our speaker for today's session.
Good afternoon, everyone. I would like to welcome Dr. Aniruddha Basu, Associate Professor, Department of Psychiatry, AIIMS Kalyani. He has completed his MD in AIIMS New Delhi, DNB in NBE, PDF Addiction Medicine in NIMHANS, DM Addiction Psychiatry in PGH Chandigarh, and he is a certified addiction physician by International Society of Addiction Medicine. And he has about 40 research publications and book chapters to his merit, involved as primary and co-primary principal investigator in different funded and non-funded projects. And he has won several awards in national and international conferences. And he has also played an important role in developing addiction services and teaching at AIIMS Rishikesh. And he is also a member of Indian Psychiatric Society and Indian Association of Social Psychiatry. And his areas of interest include addiction psychiatry, qualitative research, addiction sleep interface, and establishing addiction treatment facility. I welcome you, sir. And now we will be displaying case vigilance following by Dr. Aniruddha Basu's sessions.
The first case vignette for today's session is Mr. Y, 25-year-old medical student who has passed his final year exams a year back but still has not joined internship, was referred by management to psychiatry department for same complaint. On history clarification with his friends and his mother, it was found that he was consuming cannabis 3 to 4 joints per day along with 10 cigarettes per day for the past 2 years on daily basis, along with his friends. His parents were staying abroad. After his final year examination, he was staying alone in his home and was allegedly consuming cannabis bar cigarette the whole day. His interaction with his friends and family members was significantly reduced. Though he has not joined internship, he apparently told his family that he has done so and claimed increased work overload for his reduced interaction. Whenever he came to buy cigarettes, food in public place, his friends noticed him to be poorly groomed and unkempt and also seemed to have lost significant amount of weight. They have noticed him to be talking or smiling to himself and would try to be avoiding interaction with others. When tried to initiate conversation with him, he would often give irrelevant replies and would get irritable. Due to this chronic abstinentism, an official communication made by management to his family member. Please analyze and discuss the situation. Please give your valuable inputs about this. This forum is open for discussion now, and we will give 10 minutes and you can put your answers in the chat box. We would like to welcome Dr. Padmavati ma'am, our Vice Principal Student Affair. Thank you. We would request the delegates to kindly put their comments in the chat box. The discussion will happen after Sir's session. Now we will have the next case. Miss A, a 20-year-old female hailing from Chennai, pursuing her second year engineering in a private college, was referred by the management, citing that she made repeated self-injurious behavior in the past 2 years. On detailed evaluation of the history with her friend and family member, that is mother, it was noticed that since childhood she was very adamant and would have frequent temper tantrums. During her college days, she was found to be having frequent verbal spurts with her peers, teachers, parents over trivial things. And whenever someone pointed out her shortcomings, she was often found to break down with crying and rapid breathing spells, which will last for few minutes. Then she returns to her normal self. She was found to be irregular to her college, citing multiple physical complaints like abdomen pain, headache, which were increased during her academic performance. Medical evaluation was done for the same and found to have no significant abnormalities. It reprimanded for the above behavior. If reprimanded for the above behavior, She would make suicidal threats verbally and make some suicidal gestures like posting threatening pictures such as hanging noose in her social media profile. She has made multiple slashes in her forearm during such period, which were dealt with appropriate medical intervention. During interview, she was found to be irritable, not cooperative for further questioning, and claimed that she does not have any psychiatric issue. We would request all the delegates to please analyze and discuss this situation. You can post your comments in the chat box, which will be taken up after the session. Thank you. Now we would like to request Dr. Anirudh Basu sir to take over the session on mental health problems and substance use disorder among university students. Thank you, sir. Over to you, sir.
Hello. Hello.
Hello, sir. You
Hello.
can start the session, sir.
Should I start the session? Okay.
Yes, sir.
Just a minute.
Are you there? Hello. So can you switch on your video, sir?
Hello,
Yes, sir. You're audible.
I'm audible and the slides are also moving.
Yes, sir.
Okay.
Can you switch on your video, sir?
My video, okay, the video is not switched on. Okay. Okay. So the video is switched on and I'm audible also.
Yes, sir.
So good afternoon, everybody. So it is a pleasure for me to present in this session, and I think this is the need of the day to acquaint ourselves with the pressing issues which our youths face. Though I have been invited by the authorities to discuss about the mental health issues related to youths, university students, medical students. I heard that since 70 to 80% probably of the faculty are from medical background. So I have probably given the caption of stress in medical students and overview. Plus this is universal for all university students, and more than university students, it is for all youth, young people. They are their future and we need to emphasize upon their health, and we need to train ourselves. We need to train ourselves. In fact, in our center, we start, as we all know, that AIIMS Kalyani is a new institute. We started this student clinical services just 2 years back, and we are learning gradually about their issues, so we can learn together about their issues. I will definitely like to know many of your viewpoints from the case vignettes, how you handle them day to day. I think Dr. Surya, many people have given several of their viewpoints in the chat box. Hello. Hello. Hello.
Yes, sir.
It was heard what I was just saying. Hello.
No, sir. We can have, like, people don't respond much. We can have the discussions after your session.
No. I think even if they have not responded, people must have definitely experienced this type of problems, because the case vignettes which we chose are very general. Almost every week or every other day, we find such kind of student and such kind of issues in our OPD, in our student clinical services and those type of places. So now I would like to have a go of one of my personal narratives. The slide is moving, Dr. Surya?
Yes, sir.
Okay. So this was in one of my previous institute. That was a fourth-year medical student. He was known to his friend as Star Sardar. He was very brilliant in his academics and this thing. Then suddenly we had a huge shock, huge psychological, huge shock when one day he was just found hanging in his room. How did these things happen? How can suddenly one such a bright boy who was known as the Star Sardar of his batch, he was in fact the best performing, and nobody in his, some students of his batch were taking treatment from us, from our student clinical services, but it was no idea that he was having such a huge problem. Was he really was having such a huge problem that he chose to take such a risky step? The whole institute was in a shock. We reacted by saying today's youngsters are too sensitive to handle. We were more sturdy. Senior people always come up with this idea, and I also am graying of hair, so I also responded by this. You are probably more sturdy. But let's see literature. This was a famous. I looked into literature that what would happen in this, like the initial, what to say, the research on mental education in students, amongst students, and particularly medical students. It goes back to 19th century, 1869, and Bartholomew Hospital. Sir James Paget, he did one of the James Paget, the Paget's disease fame. He did a research, and there he found that at that time also, two students among 40 students, probably 2 students or something like that. Literature. I could not actually find the details of this paper. It was a very way back this paper was, but what I understood is that at that time also, psychological issues, suicide, psychiatric disorder were reported among medical students. And all these can be actually extrapolated to students of related professions and among youths in general. So suicide and mental health issues amongst medical students and other professional courses is not new. It is there for all the time, and it will be there also. We need to train ourselves. So what is the mental state of our students? This made me think, and I went back and I searched the literature. The shock of losing of my star student made me look into literature. And I found that there was a huge number of studies, and believe me, we often do this type of research, just this thing, PHQ-9 or questionnaire amongst our students, and do some research, publish some paper. Some have often got STS projects also. But most of them are cross-sectional studies, though there were quite few thousand of searches. I did a PubMed search. The studies were of with small sample size. Most were self-reporting studies. There are sampling biases, and those are very less longitudinal studies. Like people who have looked into psychiatric research, they know that the Harvard longitudinal study, this was one of the standalone studies by Vanderbilt et al. And others, but those were rare. Most of the studies have significant methodological issues. But what comes up is that this is definitely a area which needs to look into. Now, a few clarifications. Is it all going fine, the sound and these things? Dr. Surya and others?
Yes, sir. Yes, sir.
Okay. So, a common connotation is that, do we have stress? Is stress equivalent to depression? Everybody comes up, oh, I'm too stressed out. Our students often say, we often say, but is stress equivalent to depression? No, we need to understand that there is stress is quite a universal term in that sense. Under stress, there are stress, burnout, fatigue, depressive symptoms. These are like, for example, if I want to put a parity, particularly this from my colleagues who are not from the psychiatric background, maybe general medicine or general university colleagues, like it is like one having fever and one having a diagnosis of COVID or typhoid. We all know typhoid is caused by Salmonella typhi, COVID is caused by the COVID, this deadly virus. So this is the particular diagnosis, particular entity, and whereas stress is more universal, like fever, anybody can have a fever. However, stress, burnout, though those are not directly equivalent to, they are signs of mental distress. They are not often equivalent to depression, but they do have suicidal correlation with suicidal behavior, suicide, and stress also. There is a difference between the perceived stress and an ordinary stress. For example, like if I take this thing, this presentation, like I have to prepare this presentation. It can be very easy. Like I have presented this type of, I often present this type of this thing. But when I was first presenting, it was very, very stressful to me because it was perceived. I was perceiving this as a stress. Some more expert person may say that no, this I usually do. What is the problem? So that also the perception of the individual about the stressful event, that also needs to be considered. And please remember, depressive symptoms. We all are depressed when you have a presentation, our students when they have exam, when we have promotional interviews. Please remember, to have a clinical depression, we need to be, the thing needs to be persistent and pervasive. Persistent, pervasive means it needs to be persistent across all situations. Like for example, persistent over time, say around 2 weeks, and pervasive across all situations. For example, now since I'm having a presentation, I'm a little stressed out, I'm depressed, and this thing, though this presentation is definitely interacting with you, is very careful. I'm just saying for the this thing as an example purpose. In the evening when I'm relaxing at home, I'm fine. So this does not claim to be, or before the exam, this does not, we are all stressed out, but after the exam we are relaxed. This does not claim to, it should be pervasive across all situations. Our students, when they are in the university or in the college before the exam, they may be a little stressed out, but when they go home, they are fine, they are relaxed. So this does not amount to be a clinical depression. Now, how do we understand stress? Stress in that way is similar to, it is a concept borrowed from physics, mechanics. In that sense, since individual perception is very important, what might be stress to you might not be stress to me. What may be stress to me might not be stress to you. So how we understand that whether the individual, the event, for example, say an exam, say a relationship, say some other, any other thing you may take, you may take it, whether it is stressful for the individual or not, that you can have a indirect evidence. For example, whether he is having this suicidal behaviors, whether he is having some signs of impulsivity, anxiety and depressive symptoms, is not sleeping, sleep problems, is very anxious, very apprehensive. He is also having the medical problems. Those are exacerbated by stress. For example, we know different principles of psychoneuroendocrinology, and those things, they show us that stressful people, they have hypertension, diabetes, and substance use. He will never come to know that the person is stressed out, only he binges sometimes. So these may be correlates. But stress leads to substance use, or stress leads to medical problem. You cannot know it by certainty, because we all know that causality in medicine is an enigma. Even that tobacco is causing cancer, which we know of certainty, people have debated that endlessly, and later only they could reach the conclusion. So this correlates of stress, there are like there are several, just a minute. Understanding depression and distress amongst medical students. So why I chose this thing was that that among medical students, the depression and distress often amounts to like often they present with like the student is not responding, the student is not, you are sending mails for something, for some assignments they are not doing, and you consider it as a professional misconduct and that. So yes, they definitely it is, but at the background, we need to understand that the reason behind it. We can explore, we can, because a good number of professional misconduct will later find out how that they were related to depression and distress among students. Now, what is the mental state of our students? When I researched, I found that in different countries, National Mental Health Survey of Medical Students, this is in UK, this is in Western countries. They found that in Australia, they found that there is a significant amount of mental stress and distress, and you can see that among doctors, it is quite higher than compared to other professionals. So definitely it is more. Meta-analysis is done among 83 cross-sectional and 16 longitudinal studies across 43 countries. It was found that among medical students were quite high. As we see in the last slide, this is equated among different countries. We have seen in studies from JAMA, we have seen studies from other countries. There is a quite consensus that the depressive symptoms is quite higher. There is no doubt about that. However, though they are in the medical school, only a small amount, like 15%, which is quite less, they seek treatment. So you can understand the plethora of university. Many of the colleagues who are teaching general universities where access to care might not be that, there may be lower. Or on the contrary, in the medical school also, people may be quite stigmatized, people may be quite inhibited to seek treatment. So that may be also one of the reasons. So I have searched deeply into the literature. As you have seen, that I've quoted some meta-analysis. In our country, this is by Dr. Siddharth Sarkar et al. In our country, in India, 39% in some of the quite high, 34%, stress from 28 studies was 51%. So apart from this, there are some, as I said, that longitudinal studies are also more important. Longitudinal studies reported a median increase in symptoms of depression of 13.95% after joining medical school. This means stress has something to do with entering the medical school. Like if you are following the person longitudinally, and if his symptoms increase over time, then definitely that has something to do with our curriculum. So what are the reasons, associations? Just a minute, Dr. Surya, is the presentation going fine in terms of audio, video, and everything? Hello?
Yes, sir.
Hello?
Yes, sir.
So what may be the reasons? Look, again, I would like to emphasize that this is since many of the research across sectional studies and less longitudinal studies, though some are there, you can see at the literature. However, the point that has been noted are that students leaving their home for the first time, cultural differences, particularly this is more in a cosmopolitan institute, maybe Mahatma Gandhi, maybe AIIMS Kalyani, in ERMC and Kalyani, where these students from different places come. Young adults at high risk. High risk means there are some people who have positive family history. There are some people who have past history. There are some people who have family history of some family problems and those things. Pressured learning environment, relationship issues, temperamental issues. So these things put the person at higher risk. Does the curriculum is the curriculum responsible? Often we think in that lines. So it has been said that pass-fail grading rather than marks is responsible for some reduced stress. Again, these are not robust studies. We cannot take any decisions on them. These are some literature which I have found. There is also another concept of burnout. Like burnout among physicians is quite a well-known concept. I think this during COVID, we had spoken enough about burnout of physicians, and at some point of time, as a doctor, as a clinician, as a general lay person, everybody of us even in people who were like even everybody have experienced the concept of burnout. It's a syndrome conceptually resulting from chronic workplace stress that has been successfully managed. Feelings of energy depletion or exhaustion, increased mental distance from one's job, feeling of negativism or cynicism, reduced professional efficacy, and all these were there in ICD 11. Young professionals and burnout. So burnout, but the question is that do young professional medical students get burnt out? Some evidence is there that yes, they may get burnt out, some emotional exhaustion, cynicism. Like you can see from the age from the age group, 18 to 30 years. So young people, the residents and this thing, they can get burnt out because previously burnt out was considered as a concept which was only among senior professionals, senior doctors and those things, but young people may also get burnt out. Look, ragging is a concept, though it is now in all institutions. And as far as I am aware from Dr. Sarkar, heard that all that your institute and your place, they are very critical and strict about ragging. They have implemented the rules. We also here have implemented the rules, follow Supreme Court guidelines. In spite of that, everywhere some sort of ragging, or even it is not ragging. Medical schools and these things are very, even the professional schools are very hierarchical. There is a huge hierarchy, which one probably is not facing at home. So when one is exposed to the workplace, to the medical school, hierarchy often is stressful. Again, the perceived stress, it might not be to others also, for some people. And ragging, it is found to be practiced worldwide. And apart from this, there may be other, like substance use, as I've said, that substance use disorders are, substance use problems may be a proxy of the stress, maybe a proxy of the psychological distress. In this, there are also lots of studies. In a large study, we found that communist, particularly among medical students, one interesting was finding, I think it is not, is it there? It is that amphetamine was a highest probably they have to wake late at night, prepare studies and those things. So, however, whatever Indian studies I could, the dependence rates are 5% for medical students, 3% for doctors, 21 majority prescribe drugs for themselves. So university students probably they do not have that disadvantage. Medical students have tendency to prescribe for themselves. This needs to be addressed by several measures. So problematic internet use and its correlates. Another correlate of stress which has come up recently that was not there till 2-3 years back is problematic internet use. That is coming up quite a lot. And now of all distress, be it even we are building up a cohort where even for psychotic patients, whether distress is there for all. This I'm not saying for the youth. Universal expression of distress is increased this internet usage, which is probably acting as a reliever for that. So being a male and spending more correlated with problematic internet use, so that problem needs to be addressed. Another, the most severe and the most significant, which my Star Sardar taught me a lifetime lesson, is suicide among medical students. So this is a very big this thing, and we need to find out who are at risk. Socio-demographic, interpersonal, female, low income, poor sleep, low quality friendship, negative family relationships, mental health, some mental health risk factors are there. Though these are, again, these have been coming positive in such statistical studies. For the individual student, often the predictive power of each of them are quite low. Again, some other studies, this 5-year prospective longitudinal study, longitudinal studies have created because they are difficult to find out. Now, personality predict performance. Definitely, it predicts assessment at the beginning of the medical schools. Some of the schools, we do not have such a system at Kalyani. Probably Mahatma Gandhi, which is a older institution and have quite organized services, they might have that to assess coping styles at the beginning only. We have just a general assessment and the scoping styles and these things at the beginning that may give also an indicator to the your performance. But please remember with this, the population attributable risk factors are like 1 in 5,000 and 10,000 and these things. So it requires lots of efforts to find out one. But definitely we should devise a mechanism to do that. Unless we do that, our youths will be at risk. These some of the traits, some of the, I think this is not that this exact what traits and these things are related. I think that would not be much meaningful for the non-psychiatric colleagues. We can have a general discussion later. Conscientiousness, traits, responsible conscientiousness, extraversion, openness, self-esteem, neuroticism, but these are not that much important. So if I draw a trajectory, we need to identify the vulnerable individual who has a important life stage of separation, individuation, some socio-cultural factors, academic stressor. Please remember, all psychiatric disorders except dementia is onset in early adulthood. Even people are saying that dementia has onset in adulthood. So coping reserve, one idea of extremism of coping reserve, we all have seen the pressure cooker. So there should be this thing of relieving the tension, some way, some safety valve. So we need to build up the safety valve. Stress, internal conflict, time and energy demands. This the positive input may be psychosocial support, social healthy activity, mentorship, lectural stimulation. I've heard colleagues that Gandhi has very rich this cultural and these thing factors. We and AIIMS Kalyani has also developed. In this way, all institutes are developing. And another important is the the engagement, the personal engagement. For this reason, mentor-mentees programs are often important, and all institutions in that sense need to develop. Many institutions are there who have developed this mentor-mentees program, where a single person to give a more individualized care to the student, individualized to the student can approach somebody. Some other psychological techniques, I think, may be helpful for stress reduction. This is universal for any person. So now going back to our students, how to intervene. Screening repeatedly for identifying the vulnerable, managing the affected. This screening and identifying the vulnerable is very important. For example, you have a student who already have a disorder, family members, dysfunctional family stressors, and these type of things. If they happen, then we need to be very careful for the student, building support system, build up a dedicated program for them, doing self-management, stress management in curriculum, pass fail system, national survey. These are basically big words which probably an MC would look at. We are not in this thing. But what we can do is that we can just communicate with our students and communicate. We should try to know them better. So please remember, there is a word of caution in this. We need to be endlessly cautious about this thing. Pokorny et al., he's a famous researcher. He had once again said that there are, at some point in time, it is very difficult to absolutely prevent suicide, because it is like trying to save a small dolphin in an ocean full of sharks and whales. Please remember the annual suicide, because suicide is a very rare thing in that 11 or 10 per 1 lakh. So to identify that person and to give adequate protection for him, and it is over a lifetime. So it is not an easy job. So we have that challenge, but at least if we cannot, if he is put in a ocean full of sharks and whales, at least we can soften their teeth. We can damage that. So in some of the countries, some of the area, there has been a fall in the suicidal rate. Several important techniques have been used by different institutions, different countries. Please remember, if they have done other places, other countries. For example, I give the example of Sri Lanka and of the even Tamil Nadu. Tamil Nadu has done, your state has done Pondicherry, Tamil Nadu, these places. Pondicherry have not whatever, but Pondicherry has done significant and efforts in reducing suicide rate. Dr. Surya, you probably can more emphasize upon this. Kerala, Punjab has also done well. The so they have made significant and progress. And as institutions, we can do more probably within this regard. We can't let our stars die young. Thank you. Thank you, Dr. Surya. I think I have made my presentation. Hello.
Yes, sir.
So, should I do now? Hello.
Yes, am I audible, sir?
You are
Thank you, sir. Thank you for your wonderful presentation, sir. Now the session will be open for discussion. We'll start discussing about the case Vignet. First, we'll discuss about the first case. So can you stop your sharing your screen, sir?
Okay, okay. I'm just stopping sharing my screen. Resume share or no, we should pause share. Stop share. Yes. I've stopped sharing.
Yes, sir. Yeah. So the participants can start sharing your discussion in the chat box. If you want, you can unmute and start discussing it.
Okay, so should I start discussing?
Oh, yes, sir. Yes, sir.
This 20-year-old female hailing from Chennai, pursuing her this thing, second year engineering in a private college, referred citing the repeated self-injurious behavior. That I said that suicidal attempts, suicide, in the
Sir, not
Hello.
yes, sir.
Hello. Am I audible?
Yes, sir. We'll discuss this case, sir, first. Yes. Sorry.
Okay. Okay. So he was this student, medical student, passed a final year, but still was not joined internship. He was consuming marijuana. His parents were staying abroad. The members were significantly reduced, though he had not joined internship. Whenever he came to buy cigarettes, noticed him to be poorly groomed, unkempt, significant loss of weight himself, and tried to avoid interaction with them due to his chronic absenteeism. And official analyze and discuss the situation. So I think this sort of cases, at least one batch, 1 or 2 students we have found. Most of the students, what we do is that it is very common to pick him up for the absenteeism, mark him absent, and some of them do get supplementary exam, lose a year, and they may be ultimately be thrown out of the course. But if we look beyond, each story has its own, each scene has its own story to the story. If we explore, spend some time trying to understand the person, we can find that this chronic absenteeism, that I said that this is in a sense a professional misconduct. So in that sense, if we explore a little deeper, his substance use problems. Now, these often brings us, though he is not doing anything productive. If he had fever, or if he had diabetes or hypertension, what would have been our feeling? Like, okay, he's sick, he will not be able to attend class, for that reason he's absent. But since he is consuming cannabis, we will definitely say that he is just wasting his time, he's after this thing, he's after that thing. Can anybody say why we have so many different approaches for these two conditions? Though substance use disorders have been considered to be as a chronic relapsing remitting illness as diabetes and hypertension. So what prevents us from treating that? Understanding, for example, diabetes or hypertension in a young diabetic, we can explore deeper, we can explore whether he has a family history, whether he has a this thing, whether he has a that thing. But for substance use disorder, we do not do that, and we take no disciplinary action. I'm not saying that we should not take disciplinary action. That will go by its own way. But at least we should start treating. And many of the patients, for example, he is lost to self, he's muttering to self, and this thing. These may be psychotic symptoms. Antipsychotics, he will do wonders. So in this way, if we want to understand the communication, if we make, and maybe discussion with the psychiatric colleagues about this, taking a help, in this way, if we can do, then definitely this sort of thing, for such students, we can do wonders. Dr. Surya, you please have your, you can also join these things, or other senior people might be there, they can also join in the inputs, and we can take inputs from the participants also.
Yeah. So now I request the participants to discuss about your views, and then Dr. Surya will you can find you give your opinion. I request the participants to explain about the case. If anybody wants to talk, you can unmute and speak about this case.
Bimal, am I audible?
Yes, sir.
Yes, you are audible.
Asking. Okay, go ahead.
Hello.
Somebody.
Yes, sir. Yes, ma'am.
Sir, this is Dr. Leena here.
Yes, ma'am.
So this case, there is some history coming from the friends also. So if the friends were to come and give us this information, how do we deal with the friends? Before we actually go to the intern in question, if the friends have come with this history, how do we deal with the friends? Like, what do we tell them? What do we ask them? How to go about this case coming from his colleagues?
Okay, ma'am.
I think Bimal.
Yes, sir.
I think what Dr. Leena is asking, basically how to start this process. Yes, like what you can say, options are available, counseling is available, drug therapy is also available. As a faculty, how, Dr. Leena, am I right?
Yes, sir. Yes, sir. So as a faculty, what I think is, even if the student has a history of substance abuse, no one is going to come forward with that history, and no one really actually comes and seeks help. So most of the time, it is the friends who come out with exactly the same way as has been presented in the case scenario. So if it is a scenario like this, then how do we go about? What should be the conversation like with the friends in the first place? And how do we get the intern to go and meet a counselor or a psychiatrist? How do we go about it?
Okay. Sir, Dr. Aniruddha, sir. Sir, you are.
Yes. Madam, a very pertinent question you have asked. This we also face, and everybody faces this. like for example, but I would like to ask you something, like if the friends come and inform that, madam, this person, this student, he is having fever, he is having this thing, he is having some he is running temperature, or he is sneezing, or this thing, for that reason he is not even able to get up or walk. What do? We just first of all, we will ask that, please bring him, we will just have a word how he is, what is about your health. Some students, even for medical problems, fever, they want to, no madam, little fever, evening rise of temperature, nothing to worry, I'm fine, madam. Then we can ask them that, okay, fine, if you have fever, then you just take your temperature and maybe inform me if you have temperature more than this thing. So this same sort of thing we can please this is, if one thing if you want to take from this presentation, I would like to say that this substance use disorders are similar to other medical conditions, like, but only the proxy indicators are there. Though I understand the stigma, the barrier to treatment seeking is huge. There is no doubt amongst us, amongst our students, amongst everybody. So you can take a history from the friends only. First of all, we can this thing, look, these are also medical. First of all, reassure the friends, look, these are all medical problems also. So because friends try to make it, they may even give it in the social media, they may even somehow try to bully him and this thing, oh, this boy takes cigar, and this boy takes this thing and that thing, he might not interact. First of all, with his close group of friends, we need to find out some close group of friends who are really one or two people who are really his friends. Most people will pass on some comments and these things. One or two friends, we may take a history and then ask, we may take a history and ask this person to please meet us. And if we apply the principles of motivation and intervening principles, that is a huge psychological techniques. I'm not going into the details. Only the thing is that reassuring that we are there to help you. And if you have any problems related to that, tell us. And I think no institute, if one comes for help and one comes for, is going to penalize that person. I'm not sure or what is the rule in some of the institute, but most of the institute go if they seek help, and that if they get treated, and that then it is not viewed as a this thing as a crime, or nobody is booking somebody under NDPS sense. So in that sense, if he is seeking help, then let's bring him in help. We can ask that these are this thing, like his eyes are red, he is sleeping unusually, some smell is coming. To find and ask, we can educate the friends, like these are medical problems, these are problems of chemical imbalances in the brain, attention disorders, these are probably indicator of some of his stress. Bring him one day, we'll have a talk with him, and we can ensure confidentiality, we can ensure this without argumentative, like if we have the stance that yes, I am the faculty, you need to tell me whatever you need to do, you need to obey me, you need to this type of a stance. And if we come from that, if we have that, okay, fine, I understand that you must be having some problems that is leading to change in your lifestyle. Can we discuss something about your current issues? This sort of open-ended questions in a non-threatening manner, without being judgmental, then that will definitely going to help the student to come up, building the rapport. If we apply the basic skills, because please remember the three things which we need to do. One is communicate, second one is communicate, third one is communicate, fourth one, if finally we can involve some psychiatrist and this thing. Dr. Surya, if anybody, any other senior people, if they are going to add, even junior people, anybody, if they want to add to this, because this is nothing, say, black and white instruction or black and white policy or a black and white this thing SOP for that. These things need to be individualized for the individual student. This needs to be contextualized.
Dr. Anirudh?
Can you hear me?
Yeah, yes, yes.
Proud of sir. Good afternoon, sir. Nice to
Good
have
afternoon.
you in the session.
Hmm.
Myself, Associate Professor of Psychiatry, MGM CRI, sir.
Yes, yes, sir.
So regarding this case, one thing we would like to know is how much control we have over cannabis use, because it's easy to procure and it is one of the very freely available in if it had been any other use, we could at least contain it. But when it is cannabis, one thing we find frequently is that it is very difficult to make people have a control over this use. So how do you reckon, sir, we have to approach this by
Sir, one thing which we have, yes, we might not have control on cannabis, but we have control on the vulnerability. If we find on exploration that the student is having already a psychosis, maybe having a family history, or I think that was given in the vignette, something like that, some family issues or something like that, or a predisposition to psychosis, or something like that, temperamental issues, we can address them. And all studies, all the research have shown that if those are addressed, the substance use or the problem behaviors definitely are decreased.
One more thing I would like to ask in this regard, sir. Given this globalization era, most of our students, they are exposed to internet and the theories and the internet, and they come with a preconceived notion that weed smoking is something which is to be which is normal and which need not be pathologized and other things. So how do you think we can psychoeducate them about this?
Look, I think this is a very good question and a very practical thing. Yes, students do come and do this thing to us. Look, the thing is that that's a fine balance. Like, for example, I use often this to students. I use often this example that water, we all know, innocuous, everybody drinks water. But for a patient with renal failure, if they drink excess water without any structured form, that is going to be even death. It can cause death. So the thing is that law is in its place. At present, India, as per the law of India is concerned, except bhang in some states, cannabis is illegal. It is the choice of the student, it's the choice of the individual, and as per campus laws are there that need to be strictly followed. As doctors, as teachers, as these things, we need to address their vulnerabilities. For example, if the student tells, no, it's fine, and people do no problems of smoking in cannabis, but at the same time we need to part of them in an individual. That is the way, communication and finding the individual context. But at the same time, we need to remember that you have a positive family history. You have a temperamental issue in your childhood. You have some, whatever it is, some ADHD behaviors. That makes you at higher risk of cannabis use, at high risk of complications due to cannabis use. Ultimately, it's your choice. You put the person responsible. They are adults, all of them, all the students are more than 18. We cannot just dictate, no, since it's this thing, since it is this thing, you cannot do that. You cannot take cannabis. The moment we say he considers us to be, he considers the person who says that is a distant person, is in the opposite forum. The moment you say okay, fine, I understand that that you are probably having some craving and this thing for cannabis, probably your friends are taking, but please remember that you are at high risk or because of a family history, because of whatever reasons and you have. Rest is your choice. If you make them responsible, they will definitely come up with some. Maybe they can take help. Maybe some people have quit. I give you an example in this, a statistics, core statistics. Like for example, this paper by Nora Volkow, this is in New England Journal of Medicine. Sometime like 16 or 18, in 2016 and 18, where they showed that 100 people who tried cannabis, 10% developed dependence later. Rest of them quit, they probably experimented and they left. The same is with all substances also. For tobacco, it is higher, say 30 or 40, alcohol, it is 10 to 15. So please remember, it is not that everybody who experiments, who tries, or maybe occasionally will become a dependent and will have problems. It is the vulnerable people who have emotional dysregulation, who have personality issues, who have positive family history, they will be this thing. So we need to have special care for those individuals. I think I have addressed your question, sir. Even if I think other people can opine or you have some other viewpoints, I would be happy to learn,
Yes, sir.
to see your viewpoint.
Yes, sir. Thank you, sir. And we got one more question. Like Dr. Lina has asked, are there any particular signs and symptoms which we should look for to suspect substance use? Dr. Surya, like, can you answer? Yes.
Hello, ma'am. There are certain signs indicative of cannabis intoxication, characterized by this conjunctival injection that is commonly seen as redness of eyes, then followed by dryness of mouths, and tachycardia will be there, increased appetite will be there, and a sense of slowness of time, a subjective report, the patient or the student, they themselves say there is some environment, everything is slowed down, and some euphoric symptoms by excessive cheerfulness, those can be seen during active intoxication. During withdrawal, you can see irritability, anxiety, restlessness, sleep disturbances, decreased appetite, and dysphoria. These are the common signs of cannabis intoxication and cannabis withdrawal. Thank you.
Thank you, Dr. Surya. This is a forum for all students, university students. Whatever you have highlighted is about the signs, what we note as a physician. So is there any way that other people from other universities, faculty also can recognize their students? Suppose you have told that there will be increase in heart rate, tachycardia and other symptoms. Those are not actually visible. So any particular symptoms not pertaining to cannabis alone, is there any substance abuse common symptoms which can any person, even the parents can note it down and ask, can raise the concern about that?
Can I answer?
Yes,
Hello?
sir.
So yes, as very well said, Dr. Surya and Madam, your concern is also appreciable, that people who cannot measure this objective parameters, because as physicians, when the clinic, we can often do a urine toxicology test also, which is often confirmatory in that sense. Now, one thing was that which Dr. Surya mentioned probably was the intoxication. At that time, the patient for us redness of eyes, smelling of cannabis, behaving in a weird manner, not having sleep, very anxious, pacing here and there, very irritable. Those are symptoms when the person has just consumed cannabis. But for example, the student is consuming cannabis in his college and coming in late evening, when at that time probably he is not intoxicated. During the last 2-3 hours, he has not consumed. But at that time also, there are some ways by which the parents can understand. And for example, altered sleep pattern. For example, his irritable Mood irritability can be quite persistent and pervasive, the substance use. If he is more angry, anger outbursts are there. The redness of eyes can present for 24 to 48 hours also if he is taking it heavily. His cannabis use, if it is a little chronic, once or twice use will not lead to, but chronic cannabis use may lead to some attention concentration deficits, which will lead to poor scholastic performance. So this poor scholastic performance, unexplained, probably he was quite doing good in his subject. Suddenly he started some alteration in sleep-wake cycle, some behavioral abnormality, some irritability, some anger outburst, and drastic decrease in this thing. So at that time you can inspect off and the person may be assessed for substance use. So these are other proxy indicators. So with this, I think.
Thank you, sir, for explaining about that. Pertaining to this case, actually, the parents are staying abroad and he is showing some symptoms like chronic absenteeism. And who is more responsible in this case? The parents are abroad. Whether the faculty should take care of this issue or the friends who are closely moving with the student, who is having the more responsibility here, sir?
Madam, you are saying about the instance of an individual institute that depends upon the institutional rules and that. But as the thing is that anybody who is nearby, let's forget about the rules and regulation. Anybody who is around nearby, as friends can come up with this. Friends may inform faculty. Even this has happened. Still remember in any of one of my gigs when we are there, somebody was taking substance heavily. We informed our faculty that he is not getting up from bed. He's just every day he's mailing, today I'm not well and today I'm not well. So we informed the hostel warden and the hostel warden informed the faculty member. So anybody can take up this responsibility because substance use are a global problem. They have the high prevalence. Only we need to have an understanding that these are chronic medical problems like diabetes and hypertension. For example, one young diabetic student has insulin and is hypoglycemic and falls off in his room, not responding. It is whose responsibility? It is responsibility of the person who is around to just care for him. I'm not sure if I have been too harsh or too direct or too blunt. Hello?
Yes, sir.
Yes,
Okay, sir.
Thank you, sir, for giving the explanation. This question goes to Dr. Surya Kumar. What is the role of the parent in this case? How to handle the student after knowing the incident?
In this case, what we did was we informed the management actually sent an official communication. Post that, we had the opportunity to meet the parents in our outpatient department, and we explained and psychoeducated what all the causes, probable causes, prognosis of the patient. And since one of them in the chat box has already suggested about this controlled environment, that's what we suggested the family members. Since he's in his active use and he's become dependent, right now it's difficult to manage him alone or with a friend. So either we requested a guardian, appointed guardian, or a parent to stay along with him, provide us some kind of a controlled environment for a few months while we try to address his psychotic symptoms and his cannabis withdrawal symptoms also. And once we have tried to implement that along with our antipsychotics and other benzodiazepines, he was able to maintain abstinence even in the absence of a parent after a few months. Thank you.
Thank you, sir. And we have few questions. Seems a little bit complicated also. Like Dr. Jafrin has asked, are we bound to report about the cannabis abuse to anyone? So seems a bit a complicated question. Like since we are treating the students, which should be confidential, since they are prone to suffer, so it seems to be a confidential thing. So here it's a diplomatic question whether to report to higher officials or seems to be a complicated one. And-
According to NDPS Act, it doesn't warrant any mild or use of cannabis to be reported. I think it is possession of cannabis in a limit
Sir.
more than what is set by the government, that is bound to be reported.
Sir, may I chip in with something? Hello?
Yes, sir.
Sir, in this case, law is quite clear. There are two instances. One is the individual person who is suffering. And for example, the student is consuming and he is now not under the purview of law. More than law, he is under the purview of care. He needs care. He has an illness, substance use disorder, and he needs care. But for example, for the instance in which he has probably he is not psychotic. This case is definitely psychotic. He doesn't have any judgment. But if he is not psychotic, he is taking the substances and he is peddling the drugs to his friends, to others, maybe nearby colleges also. Then an attempt needs to be made to bring him under care. And if he is not, then that amounts for a criminal action, and that amounts for this thing, because law has differentiated into what sir said, that small amount possession, that is more in the context of the individual patient. But if it is not that amounts to, for example, some action. And regarding the law of the institute, that I think it is variable upon the institutes, but everywhere we need to have some confidentiality and privacy. At the same time, this is a balancing act which psychiatrists and physicians and often concerned faculty members need to play, a balance between commitment to the individual student, and probably with great courage he has conjured up and he has said and reported to you that, Madam or sir, I have committed this mistake, I have taken some substances and I am not able to quit it. Please do not tell it to the higher authorities. And at the same time, often many of the institutes demand that you please report, whoever is consuming, you please report that to us. So a balance needs to be taken, but that depends upon the rules and regulations of the individual institutions.
Okay, sir. Thank you, sir. And we have the similar questions like the steps to make the campus substance abuse free, like asked by Dr. Jeffrey as well as Dr. Lina. Like if Dean sir is available, can open about this. Dean sir, Dr. Sitesh sir.
Yes, Dr. Bimal.
Sir.
Basically,
Yes, sir.
Yeah, basically, as you know, like as everybody is discussing about finally the student awareness and all these things.
Yes, sir.
As you know, like what you can say, like from government side also, they ask us to conduct the campaign rallies and all these things, where the students take active participate to aware the student community itself. So and as you know, like as everybody is rightly pointed it out, that naturally every institute, they try to protect their student. So definitely this type of activities are not reported to higher officials. But many instances we have come across, like what you can say, when we get the request from the police itself, right? So these are the things has been noted, and please have a eye on this. So basically we try to keep those students at the surroundings, especially observation by the wardens and all these things, if these things is happening inside the campus or outside the campus. Because what is happening outside the campus, in fact, it's a naked truth that it's not that nothing is happening and police is not knowing it, right? So everything happens with the knowledge of the police and the government and all those things. but still I feel that what you can say, we should have that mindset first. It's a multi-pronged approach, right? So if the cannabis is why the basically the policies what the government take, that there's not be any wine shop or this type of activities nearby the institution and all these things, and that is where the what you can say administration or the police has to take a part. What we can do as a inside the campus, somebody was asking, yes, we can have this what you can say, like everybody should be watchful, starting from the student circle to the warden, and it has to be brought to the notice of the administration. Yes, what Dr. Surya has told, like, yes, wherever required, we need to, Dr. Anurit also was emphasizing on talking to the students, counseling, involving parents, and all these things, at least we can do. Definitely, as an administrator, definitely I'll not report this to the police, right? Because it's a practical that, as you know, it brings the reputation of the institution at stake. Everybody, all the institution, even premier institution also this happens, but nobody so much they go to the police to report that the student is having this, unless it is requested by the police to inquire the students and all these things. So that is what my, like, it's a very difficult, like, what is a tricky scenario. Everybody knows the answer, but nobody is in a position to solve the matter, starting from the government to the students. So this is my opinion.
Thank you, sir. So actually, each and every institution are supposed to contact, like, according to the government, like they are sending
Yes.
Celebrating International Day Against Drug Abuse and Illicit Trafficking, like,
Correct.
so which is conducted on every year June 26. So which was supposed to
Yes.
be conducted in each and every institution. So the government made each and every institution to make our awareness program in their institution. So
I
even
think
Yes, sir.
one more thing is I think all the institutions are supposed to form on I think Dr. Padma can highlight on that anti-narcotic cell, where with the 10 representative of the students. I think last year it was initiated. Dr. Padma, if you are there, you can highlight on that. With a nodal officer, 10 students representative who will work as a what you can say champions or the ambassador for
Yes,
the
sir.
student.
From the
Yeah.
government, they have requested to create an anti-narcotic cell with the faculty and student members. And we had 2 meetings after that, and they asked us to track, because we are in close contact with the student population. And recently in Pondicherry, it's more prevalent nowadays, the substance abuse. So they want us to inform us, and they told it will be kept confidential as much. They have given a toll-free number also. The only thing is, here we need coordination from all aspects. We need coordination from the parents, from the friend circle, from the faculty. So if we work in hand to hand, then only we can find a solution for this problem, sir. So everything should work in a proper way. Definitely we can succeed.
Yeah. Thank you, ma'am. Thank you, sir.
Sir, apart from awareness, what is the role of this anti-narcotic cell, sir? Apart from spreading awareness?
Madam, actually, the government, they have asked us to create the anti-narcotic cell, mainly to gather data. If there is any pertaining to that institute, anything of substance abuse we come across, they want us to report to them, and also create awareness among the student population. This is the major role of the narcotic cell, ma'am.
But reporting substance use among students, like, was it successful, ma'am? Like at SPV, I think you are doing this. So is it successful? Like, students, are you able to actually pick up?
Ma'am, actually the students, some students report to us, and we'll try to sort out the issues. But it is, it's recently started one. It's not in a full-fledged manner. We haven't gone in detail. So we need some more time to work on this, ma'am.
Okay, so is the government in some way supporting, like providing anything to help the students, ma'am?
Ma'am,
Through the program, is it providing any assistance?
no, ma'am, they are just, they want us to be involved more because they can't directly go into the institute and find out the solution for this. So they want our involvement more rather than us, the others, especially if them on their own.
Okay, thank you, ma'am.
Okay, ma'am.
To this, the government has supported. I mean, they make the institutions to gather. I think in some 2 years before they asked. I mean, they conducted in the governor office also. So where they made a program also.
Yes.
Yes. Okay. So about this case, like whatever we can have further discussion in the WhatsApp group. I will move to second case Vignet. I will try to wrap up finish the case as soon as possible. So this is a case like which people generally see in your classes, like Miss A, 20-year-old female hailing from Chennai, pursuing her second year engineering in a private college, was referred by the management, citing that she made repeated self-injurious behavior in the past 2 years. On detailed evaluation of the history with her friend and family member, it was noticed that since childhood, she was very adamant and would have frequent temper tantrums. During her college days, she was found to be having frequent verbal spats with her peers, teachers, parents over trivial things. And whenever someone pointed out her shortcomings, she was often found to break down with crying and rapid breathing spells, which will last for a few minutes. Then she returns to normal self. She was found to be irregular to her college, citing multiple physical complaints like abdominal pain, headache, which were increased during her academic presentations. Medical evaluation was done for the same and found to have no significant abnormalities. If reprimanded for the above behaviors, she would make suicidal threats verbally and make some suicidal gestures like posting threatening pictures such as hanging nose in her social media profile. She has made multiple slashes in her forearms during such periods, which were dealt with appropriate medical interventions. During interview, she was found to be irritable, not cooperative for further questioning, and claimed that she does not have any psychiatric issues. So, about this case, can we put in the chat box, the WhatsApp group, since we lack
somebody else.
Okay, so psychologist Sarandan has suggested the student will be benefited through dialectical behavior therapy. Yes, sir. Before the therapy, we'll discuss about this case. This is the most common behavioral symptoms which each and every person, every faculty might have encountered in their life. So, always, the students with social gestures, behaviors, threatening behaviors, temper tantrum behaviors, and frequent absenteeism from the classes. So, since can we? So I think the participants can post in the WhatsApp chat box, WhatsApp group about this case. So we can have a discussion, further discussion in the WhatsApp group, since we are lacking out of time. We are running out of time. If anybody wants to talk, you can unmute and talk about this case for a few minutes, or else we can have in the WhatsApp group. Okay, since we are already running out of time, so supposed to finish earlier, we can close today's session. So thank you, sir. Thank you, Aniruddha Basu, sir, for your wonderful presentation. Thank you, Dr. Surya, and thank you, ma'am, and thank you, Dean, sir, for the presence. So thank you all the participants for your valuable presence. We can have further discussion in the WhatsApp group. The next session will be on coming Thursday between 2 to 4. We request all the participants and their inform your friends and colleagues to join the session. Okay, thank you. So
Thank you.
with this, we'll conclude the session. Thank you.
Thank you,
Thank you,
Dean
thank
sir,
you.
and other authorities for giving me this opportunity. It was wonderful interacting with you all. Thank you. Thank you.
Thank you.
Thank you, sir.
Thank you.